Seinfeld star Michael Richards recently revealed that his battle with prostate cancer in a new memoir about his life. He was diagnosed 6 years ago and has since underwent surgery to remove it. And joining us in studio is Dr. Richard Chaffoo to discuss how important it is to get screened. You know, Dr. Chaffoo, I was looking at some of the numbers, and prostate cancer is the most commonly diagnosed type of cancer in the country, excluding skin cancer, and the second leading cause of cancer in men worldwide, 1 in 8. It's
true. It's a significant health risk. You know, there are over 180,000 cases each year that are diagnosed in prostate cancer, and unfortunately, Maria, the public may not be aware of it and aware of the disease itself and how relatively common it is. It's a disease also of aging. So as men age, as we get beyond 65 or 70, there's just a higher risk of developing the prostate cancer, and oftentimes it's not diagnosed very early, but in later stages, as we saw in this one actor.
Well, let's get to it. Why is it important to get screened, and what are some of the early warning signs?
So, unfortunately, there are not a lot of really early warning signs for prostate, but it's so important to get screened. If you look at recommendations now from the American Cancer Society, their recommendations are after the age of 50, really every guy should get a digital rectal examination and a PSA or prostate-specific antigen, which is a blood test, easy to do. However, African American men are twice as likely to get prostate cancer than any other ethnic group. So the American Cancer Society recommends beginning at 45. Also, any other ethnic group, Maria, that has a first-degree relative, either a brother or a father, that had prostate cancer before the age of 65 should also start screening at the age of 45, and 2 or more first-degree relatives, it should be 40.
You know, Michael Richards had surgery in order to remove his prostate cancer. What are the normal treatments for something like this?
So the normal treatments are really 2 different camps. You know, one camp, it depends about how extensive it is. So if it's a relatively early prostate cancer, many people will recommend a prostatectomy, which is a removal of the prostate, either robotically or non-robotically. Then there are seeds, radiation seeds, or external beam radiation that can be used. So there are really great treatment options available, and there's a very high cure rate, like any cancer, when it's caught early enough. The problem is that people just are not aware of the fact that by the time you start having blood in your urine, you start having bone pain, you know, difficulty with urination, or having to get frequently, it may be a more advanced tumor. But I think it's also important to remember that as men get older, we get enlarged prostates anyway, so it's not necessarily indicative of prostate cancer, because you have to get up at night a lot and use the bathroom, or you're having difficulty with the stream. All of those may just be signs of advanced enlargement of the prostate.
So there are other medical conditions that mimic prostate cancer that we should look out for?
Yeah, right. Benign prostatic hypertrophy being the most common, of course. Prostatitis, which is more of an inflammatory, you know, burning pain, some difficulty, you know, pain in the perirectal area, treated with antibiotics. So, and really, benign prostatic hypertrophy is, again, just a part of that aging process.
What can we do, I guess, what can men do to lower their risk of prostate cancer?
2 things. Digital rectal examination and yearly PSA testing. Very, very simple, basic tests that your primary care physician will do, and can kind of plug you into the system in terms of, you know, when to get those tests done. But certainly that's at least a yearly screening from the age of 50 and onward.
Well, like I said, 1 in 8 U.S. men will be diagnosed with prostate cancer at some point in their lives, and it increases with age. So go get screened.
Please.
It's so important, right?
It is, and I think we can dramatically see a reduction in that incidence once we get people to understand the disease, caught early, diagnosed early, like any other cancer, is very treatable.
Dr. C, it's important information for a lot of men out there who just who don't even want to go to the doctor. I think that's the tough part.
Exactly.
Thank you so much for breaking that down for us. We appreciate it. All right.